And welcome back, everybody. Oh, our sign shows up so good.
It does.
Okay, we have got Terra Joyner this morning with us, and it's so appropriate that we would be talking about the Healthy Heart Fair this morning since it's Valentine's, and it's also Heart Month, Terra.
It is Heart Month. It's very exciting, and it is great to be here on Valentine's Day.
Yes.
To talk about the real heart, not just our loving hearts.
That's right, and that is so important, and I think it's great. I think this Heart Fair is the second one. It's the second annual, isn't it, Terra?
This is our second annual Heart Fair. We started this last year. It was an idea of our unit-based council, and it's a group of nurses and staff that work at the Heart Center, and also with Dr. Martin. She wanted to do some community awareness, and so this was just a great forum to be able to partner with Dr. Martin, with Nash UNC Cardiology, and our staff at the Heart Fair to bring awareness of heart health to our community.
Well, they say knowledge is power, and if we know the symptoms and the signs, we can be looking out for things, and it's so important. Prevention is everything, isn't it?
Absolutely, and that's the number one reason we're doing this. Like you say, knowledge is power. So many times people don't recognize their symptoms of a heart attack, and we want people to be able to know that and know the risk factors that predispose you to having heart disease.
So you are trying to educate the attendees of this fair. Now let's talk about first, when is the Healthy Heart Fair?
It is Saturday morning, February the 16th. It is at 10 o'clock. It starts at 10. It's 10 to 12, and it is in the lobby of our Heart Center at the hospital.
Okay, very good. And for those of you who don't know where that is, when you drive into the campus, you just kind of keep driving around, kind of by the emergency room, past the emergency room. Is that correct?
Yes.
And you'll see it.
Yes, and you can park in the on the top deck of the parking deck and just walk straight across. You'll see it.
Tell us what can we expect when we get to the Healthy Heart Fair? I know you'll have different booths set up. Can you tell us some of that?
We will have a lot of different booths. The first thing that we'll have is, for the first 50 attendees, we'll have a blood glucose and a cholesterol check. So that will be free to the first 50 attendees. And then we'll have blood pressure check. We'll have a BMI station that lets you know we do your weight and height and give you a number that kind of tells you if you're predisposed to heart disease. We'll also have a nutritionist there with information about healthy eating. Our cardiac rehab staff are going to be there to talk about the importance of exercise. We'll also have a station for CPR, to do hands-only CPR
you kind of
education.
Running the gamut.
I know. Smoking cessation and a booth on the early symptoms of heart attacks.
Wow. So much to learn there, and we never know. It's always good to get your blood pressure checked, your cholesterol, your glucose. I mean, you just never know. Maybe you're feeling bad, you're feeling tired, you don't know why. Well, go on out there, because guess what? Guess what the one word is that people will like? Free.
Free, absolutely. Dr. Martin's also going to be there, which is going to be very exciting, because you can have the opportunity to speak with a cardiologist one-on-one, and she will look at your risk factors that from the stations that you've gone through, and just kind of give you some ideas of what you need to do to be more healthy, or if you need an appointment, we can go ahead and get you scheduled in our clinic to see someone. So I think that's a very important aspect of this also.
Okay. Well, the numbers, 100 million adults in the United States have high blood pressure.
Absolutely, and that is one of the predisposing factors to heart disease. There's so many things that you can do to prevent heart attacks and prevent heart disease. You can't do anything about who you are, who your mom and dad are.
That's right.
But there are so many preventable things, and hypertension is definitely one of them. They've changed our hypertension guidelines recently. So patients, really? Yes, so patients are being treated for hypertension much earlier than they were before. And so I think that's going to show in the future. A lot of patients actually get upset that they have to start on hypertension medicines earlier, but it's a great thing.
You're going to get more upset if you have a stroke because of it, or a heart attack.
Absolutely.
So it's always good to take that medicine if you need it.
Yes.
So anyway, as you said, you learn the early warning signs and symptoms of heart attack, which are chest discomfort, shortness of breath, shoulder and or arm pain, and weakness. So we're so glad that y'all are doing this. I mean, it's so important from 10 to 12, I'm sorry. 10 to 12, you've got a 2-hour window to get there, and I'm sure there may be some little bags of giveaways or brochures, literature.
Absolutely.
You can get all of that.
We will have
as
that.
a matter of fact, here is some right here.
And a quick breakfast. We'll have some things too. Breakfast, lunch type items.
Okay.
Yes.
All right. Well, that's very good. So we're hoping that you all will join us out there. WHIG will be filming this, and we'll be bringing it via our health show. We'll be showing it at other times as well, but via our health show with Sarah Heenan and maybe Dr. Young. We don't know yet, but anyway, we'll be bringing that health fair, some pieces of the health fair on the Here's Your Good Health show. In the future, we'll be talking to you and letting you know all about that. So anyway, you will, if you're not able to go, you will be able to see it on the airwaves, but I would participate. I would really participate because this is very important. A lot of free information. It is a great community service of this hospital, I will tell you, of Nash UNC Hospital. It is just a great community service. So we thank y'all for doing that, Terra. Anything else that we can expect when we go to the heart fair? Anything else you want to get out about the heart fair? Just come out and meet some of our staff. We have wonderful staff in our heart fair or in our heart center at the hospital, and just come out and meet the people. These are the people that are going to be taking care of you, and everyone is just family here. And so we've heard that so many times from our patients. Right.
And so we just want people to come out and know that they're cared for, and they can get good quality heart care in Nash County, and they don't have to leave home. And so just come out and meet the people that are here caring for you.
That's exactly right. We have a wonderful heart center. Y'all have gotten stroke awards and many awards and have come on here and talked about it. Very impressive. The heart center at Nash is very impressive. And as you said, they do treat you like family, and they do care about you, because if not, they wouldn't be bringing this free information to you and this healthy heart fair, because you do want people to know their numbers, and it's just important to be educated.
Absolutely.
When it comes to your heart. So we thank y'all for doing this. Go around to all the booths and check them out, and so we'll see you on Saturday.
All right.
This Saturday, the 16th. It's this coming Saturday, folks.
2 days.
So take advantage of it. Take advantage of it. It's going to be a great healthy heart fair. So Terra, again, we thank you for coming in, and we will see you Saturday.
All right. Thank you so much for having me.
Thank you. We'll be right back.